What does the project have to offer volunteer medical students and professionals?
Well, I think that what we offer is access to a community that sort of doesn't use medical services or doesn't take advantage of medical services in a traditional kind of way. And so the fact that we provide medical services in a low threshold environment, and certainly a free environment, allows medical students to sort of become exposed to a different population that they normally wouldn't see in usual practice. In usual practice facilities, we sort of provide that piece of it. The other thing is that, there are times when, we're taught to, seeing drug users is something, and providing medical services to drug users is a skill that we need to encourage physicians to develop, because I think that, it sort of makes someone feel welcome when they come into a traditional medical practice. So a client, hopefully if they see one of our physicians down the road, or someone who was our student and came through the program, then they're able to sort of feel comfort in a more traditional medical setting.
How would you like to see the project continue to grow in the future?
I think I said it earlier, a lot of volunteers, more volunteers. We'd love to set up more clinics. We'd love to be a lot more mobile. We would love to increase the kind of care that we could give out in the vans. So I think that that's some of the ways that we would love to expand.
How is the Streetside Health Project being sustained in this difficult economic climate?
Well, first and foremost is through the sweat of our volunteers. I think that that's a piece that, we get a lot of volunteer hours, so I think that helps us maintain it. But also, the generous foundation donations that we get. The First Hospital Fund helps us. The Patricia Kine Foundation helps us. Pew Foundation helps us to all maintain the kind of service that we provide. And at one point or another, we're hoping that this project becomes a project that we can present down the road for some government funding, as a model to provide services where people are.
What are the resources the project needs most?
I think definitely money, because we always could use that. I think donations in the form of medications, trying to get basic needs met, bandages, Band-Aids, in lots of ways, some food, blankets, things like that I think that traditionally aren't always viewed as a medical intervention, but sort of help round out what we do. I think that, hopefully down the road we're going to encourage nursing schools to join our forces so that we could help expand our clinics and give a different kind of care as well. So I think there's lots of different ways that we can sort of expand the program and hope to see it grow that way.